Ricordiamo ovviamente questa è un'iniziativa, ripeto, seconda sessione, nell'ambito organizzata e pensata nell'ambito della presidenza italiana del G20 e ovviamente la inquadriamo in questa fase drammatica, direi fase storica, che tutti noi non avremmo voluto vivere, che è quella appunto della pandemia e ci auguriamo di poter dire oggi serenamente post pandemia. La sessione di oggi proverà ha l'obiettivo di porre l'accento soprattutto sul tema relativo alla salute globale e quello ovviamente è tutto il tema dello sviluppo sostenibile, pensandolo però e attraversandolo finalmente con uno sguardo di genere, soprattutto pensando alle donne e alle politiche per le donne dentro diciamo, questa dimensione. Quindi che cosa e come le donne oggi stanno dentro questi grandi temi esattamente in questo contesto storico. Vorrei dire davvero soltanto una cosa, a me spettano pochissimi minuti soltanto per aprire questa sessione. Una riflessione che credo sia doverosa per noi tutti è che questo tempo e questa drammatica epidemia hanno rivelato nella loro drammaticità, nella loro anche, come dire, radicalità, i limiti, io credo, i limiti di un modello di sviluppo che non poteva più essere sostenuto così nel tempo. Credo che la stessa pandemia sia il frutto di questi limiti, lo dice la scienza, cioè il modo in cui ci siamo rapportati, abbiamo ritenuto, qui senza alcun senso del limite, di poter sfruttare e utilizzare le risorse del pianeta, la poca cura che abbiamo avuto verso il pianeta, la poca cura che abbiamo avuto sostanzialmente per il benessere, per la qualità della vita delle persone. Benessere e qualità della vita delle persone che intrecciano ovviamente il benessere e la qualità della vita delle donne. Questo è un pensiero molto femminile, io direi, oserei dire femminista, che è stato a lungo, secondo me, sottovalutato e non valorizzato, così come avremmo invece dovuto e potuto fare. Io credo che se dovremmo in qualche modo tutti quanti noi approcciare a questo tema con questa consapevolezza, se qualcosa di buono vogliamo trarre fuori da questa pandemia, da quello che ci ha segnato anche in onore delle tante vite andate via, delle tanti morti purtroppo e dei tanti sacrifici richiesti a tutti, a tutte noi, forse questo sarebbe l'insegnamento più importante. Il senso del limite nel rispetto della presa in carico e della cura dell'ambiente e la necessità di pensare a uno sviluppo e a una qualità della crescita che non può essere solo crescita economica, ma deve essere crescita della qualità della vita, del benessere delle persone. Quindi cura, welfare, salute, investimenti nella sanità, nell'istruzione, nella scuola, nei sistemi di formazione, ma in tutto quello che è presa in carico e cura delle persone. E tra questi ci mettiamo sicuramente l'ambiente, che significa pensare anche al contesto nel quale viviamo. Ecco, credo che rispetto, se forse gli obiettivi che ci eravamo dati per il 2030 hanno ovviamente sentito e registrato un'importante, drammatica battuta d'arresto, credo che però su questo forse con l'insegnamento che ci lascia questo tempo potremmo finalmente cambiare registro. Non posso solo non fare cenno nel salutarvi e nel passare la parola a chi viene dopo di me, non posso non fare cenno al tema drammatico a proposito della cura e della presa in carico e della centralità della persona del tema della violenza maschile sulle donne, in termini di salute anche delle donne, che è salute, che è anche salute riproduttiva, ma che è soprattutto salute e benessere psicofisico delle donne, che è anche e soprattutto, ricordiamolo, una registrazione di un'ancora profonda, drammatica simmetria di relazioni di potere tra gli uomini e le donne. Le violenze in questo tempo si sono acuite, le violenze domestiche in modo particolare, la difficoltà di accesso ai servizi alla salute riproduttiva, ma anche alla sicurezza, le reti di protezione delle donne si sono notevolmente affievolite e questo è stato sicuramente un ulteriore limite mostrato da questa crisi. Su tutto questo credo siamo chiamati oggi a riflettere. Ho parlato già troppo, credo di avere superato i miei 5 minuti, quindi vi ringrazio davvero, credo che l'occasione sarà davvero un'occasione preziosa quella di oggi, per ragionare tutti insieme di questi temi. Io passerei la parola a Martin Smith, che è il direttore esecutivo ad interim e amministratore delegato di Family Planning 2030, e so essere un appassionato e convinto sostenitore della necessità di fornire soprattutto servizi di salute, mettendo però salute anche riproduttiva di alta qualità, ma mettendo soprattutto al centro, come ci siamo detti, la persona, quindi l'utente finale, ma io direi la persona. Ecco, quindi è a lui che passo con piacere la parola, ringraziando davvero voi tutti per l'attenzione. A lei, Marty Smith.
Grazie. Thank you so much, Senator Valente, for your inspiring opening words and your challenge that you've laid down to us as we embark on this afternoon session on global health. And I'm very privileged to be leading us off. And from my seat as Interim Executive Director of Family Planning 2030, I've witnessed the consequences of ignoring the gendered impact of health policies, as well as the promise that applying a gender lens brings for healthier communities and stronger economies. The COVID pandemic continues to have a profound impact on the lives of people across the globe, as we all know too well as on those health and social systems and on national economies. Last summer, 2020, clinic and pharmacy closures, curfews, and cut supply chains created a profound disruption in family planning services and information across the globe, as well as in sexual and reproductive health more broadly. Now, despite this disruption, the need for family planning did not change. Of course, for most women, family planning is critical, basic healthcare, life-saving healthcare. And yet the United Nations Population Fund estimates that 12 million women were not able to access family planning during the 12 months from March 2020 to 2021. And the average period of disruption of women in their family planning services was 3.6 months across the globe, that perhaps resulted in as many as 1.4 million unintended pregnancies, changing women's and families' lives forever. COVID is truly having a gendered impact, and it needs to have a gender-inclusive recovery. As health systems shifted to prevent COVID and treat those with the virus around the world, Family Planning 2030 worked with country and global partners to ensure that family planning remained a priority service in countries' COVID-19 response plans. And while we couldn't eliminate all the disruption, family planning services did recover remarkably. Organizations worked together to increase telehealth services, the use of mobile health volunteers, of self-care contraceptive methods, such as the self-injectable contraceptives, and governments and healthcare providers worked together to supply remote health clinics with several months of supplies in many cases to ensure that services could stay open until supply chains recovered. At the beginning of the crisis, UNFPA's predicted the estimate would be at 47 million women without family planning. So that updated estimate of 12 million does represent quite a remarkable turnaround from the opening weeks of concern in February and March of 2020. And this collaboration across borders and sectors has strengthened our resilience as a community in the face of this and future crises. Sadly, great dangers still lie ahead as health budgets need to adapt to the impact of COVID-19. In April of 2021, the United Kingdom announced that it would be cutting its foreign aid budget by nearly 30%, including a deep reduction in its funding for the United Nations Population Fund's flagship supplies program. And UNFPA Supplies does work very hard and ensures that reproductive health commodity stocks, including contraception and medical equipment for family planning programs, are positioned in scores of countries around the world. With these funds, UNFPA Supplies would have helped prevent around 14.6 million unintended pregnancies, 4.3 million unsafe abortions, and 250,000 maternal and child deaths. And the International Planned Parenthood Federation and MSI Reproductive Choices have also reported deep cuts in their funds that will force them to close or severely curtail programs. The financial imperative of protecting family planning and reproductive health services is clearly in front of us today. It's not only the UK cuts that are worrisome. The pandemic has led to immense disruption across a range of health services. Around the world, the economic impact of COVID-19 has already begun to present immense challenges to family planning programs. Many national governments are facing the prospects of reducing domestic funding for family planning programs in order to prioritize COVID-19 response. And we need to make clear the critical importance of family planning within that response as part of building back better. It's at moments like this when it's clear that to recover from this crisis and prepare for the next one, we must center the voices and experience of women and girls and work across the health and humanitarian nexus. When women and adolescents can determine whether and when to become pregnant, their pregnancies are safer and their children are healthier. Without strong investments in family planning, there will be a lasting consequence or consequences that will take months, if not years, to fully comprehend. The Generation Equality Forum will place a strong emphasis on integrating movements, and at FP 2030, we have taken this on board as well in the next phase of our partnership. People who need family planning also need fair wages. Women and girls who are disabled also need family planning, and so forth. As we recover from this pandemic, any recovery effort will be stronger if it brings together these different perspectives and lived experiences. The result will be a recovery that won't leave anyone behind. At FP 2030, we know the power of partnership. Thanks to the efforts of our forerunner FP 2020 movement and the FP 2030 partners today around the world, 60 million more women and girls are voluntarily using contraceptives today than in 2012, 30% above the historic trend lines. 48 country governments and 77 other institutions, donors, the private sector, non-governmental organizations made commitments to increase the use of voluntary family planning. FP 2020 and now FP 2030 focus countries spent around $1.55 billion of their own domestic money on family planning programs in 2018. And in 2019, the most recent year for which we have bilateral donor assistance, numbers, $1.5 billion was spent also, some 400 million more than was spent in 2012. We need to protect these amounts and grow them. In my closing, a few words, I would say that looking ahead, we will build on the success of this partnership and the important lessons we've learned over the past 9 years. Our vision for the future is one where women and girls everywhere have the freedom and ability to lead healthy lives, make their own informed decisions about using contraception and having children, and participate as equals in society and its development. In order to achieve this vision, we must break out of our sector silos. It will take inclusive and intersectional commitments to power progress towards gender equality. And it is these transformational commitments that are at the heart of the FP 2030 partnership. Likewise, if we want to come out of the COVID-19 pandemic with stronger structures that will make our systems and communities more resilient, we must work across the emergency planning, health and humanitarian sectors, including those who are most deeply affected by these crises, particularly women and young people, in all of our efforts. So thank you for your time today. I look forward to the ensuing speakers and sessions, and I wish everyone the very best in these discussions and conclusions that we do reach today. Many thanks indeed.
E se possibile darei adesso la parola all'onorevole Esther Passaris, che sostanzialmente modererà l'intera sessione dedicata alla salute globale. Grazie Esther. Grazie a tutti per la disponibilità e un caro saluto.
Thank you very much, Senator Valenti. I want to start by congratulating Italy for the G20 presidency and for the efforts to reconnect with the African parliamentarians. I also want to take this opportunity to thank Neil Datta of EPF for inviting me to lead this panel. Wow, I mean, after listening to Martin Smith, I get worried when I hear of all the cuts that are going to happen in family planning. We can't afford that. I mean, he is absolutely correct. There's so many unwanted children. And there's so many children who got impregnated during the pandemic. We've seen almost 40% of the children that didn't return back to school. It's because they're pregnant. And these are young girls that got pregnant during the pandemic because of being at home when the schools were shut down. Of course, we've also got another crisis in that we've not been able to vaccinate we've only vaccinated about 1 million people in Kenya, unlike most European countries. So our appeal would be for more vaccines. We recently got some vaccines from Denmark, but it was only about 400,000. We need so much. So we hope that in line with the commitments taken by the Global Health Summit, Kenya, Africa will be able to get more. We obviously are not able to get more from COVAX. We'll need other countries to donate vaccines, because the only way we can get back to some form of normalcy is when everybody is vaccinated. Having looked at Italy's vision of people, planet, and prosperity to get us back on track, and the SDGs 2030, right? We definitely need to ensure that not just Europe is vaccinated, but also Africa is vaccinated. We also have seen an increase in gender violence. I mean, as a member of Parliament for Nairobi, one of the things that we've realized is that we do not have enough safe houses. With the pandemic, we saw an increase in gender-based violence, and there were no safe houses. So government has actually put a lot of money in the next budget to ensure that we have safe houses. It was a big void and a big gap. Most of them were run by civil society. So for us as Africa, our appeal is that we get more vaccines, and we also we get back on track in terms of family planning, because if people could not access commodities, Africa was not left out. And of course, we've got the crisis of HIV and AIDS that also needs to be looked into. For me, the parliamentarians all over Africa being brought aboard by Italy is highly, highly commendable. And we look forward to interactions that will see us talk about the issues that affect Africa more, which basically, you know, we have issues in terms of legislation, in terms of pro-choice, where a woman can actually make decisions. We always feel that the right to make that choice is not there. And now that many women got pregnant during this pandemic and they cannot make that choice, they cannot access safe abortions. We also have challenges in legislation, but we had a landmark ruling that actually showed that maybe the judiciary is also realizing that it's not just the biological well-being of the woman, it's also the physical and the economical. So we're beginning to understand that. Most of the women in this country are single mothers. And when Italy puts health together with gender, then they're recognizing the fact that the woman has to be empowered. Mental health also cannot be ignored. So I'm looking forward to all the discussions and everything that we will talk about to ensure that we come up with solutions where health is tied to gender, because it's never been looked at in that respect. And we cannot talk about a healthy nation. Our country has universal health care as one of the programs of the government, but it's not been focused on gender. And Italy's decision to make sure that you tie it to gender, I think will be able to get a lot of the women and girls and children that were impacted negatively. I also want to mention that there is a group as well, the LGBTQI, who are also very vulnerable, and especially in Africa, that also needs to be looked into. For me, I look forward to the discussions, and I really thank Italy for their vision in terms of people, planet, and prosperity. Right now, I would like to take this opportunity to welcome Dr. Claire Wenham, the Assistant Professor of Global Health Policy at the London School of Economics and Political Science, to make her presentation, and then we'll be able to obviously go to the floor and look at all the comments that everyone would have towards merging gender and health together. Thank you.
Thank you so much, and I'm so delighted to be here with you all this afternoon. So I've been asked to give a few thoughts on gender and global health policy, and this is obviously a key issue. And I think I wanted to start by saying, you know, everything in health is gendered, right? Every way we interact with a health system is gendered. Who's able to access care? Who's able to, who's providing the care? Let's not forget that 70% of our global health workforce are women. So the people who are delivering the vaccines, the people who are caring for people who are sick with COVID, the people who are providing family planning services, who are providing maternity services, are all women. And we need to recognize this labor that women do. But it's not just the formal labor, the labor that might be paid or underpaid or even unpaid, but it's also everything else that we know women do within health systems. So when children are sick, it's more likely to be the mother, the woman who takes care of them. If children need to go to routine services, vaccination services, it's more likely that the mother will take them. And therefore, we are entirely dependent on the labor of women to interact in health systems. And I think that's the first key point. The second key point is that women are not all the same. And we can't talk about women as one homogenous group. There are different levels in which women are able to interact with the health system. Your ability to be able to seek care, to seek planning services, to seek maternity services is determined by not just your gender, but also who you are, right? We know it's the most marginalized groups who are the ones who face a series of structural barriers in accessing care. They might not be able to take time off work to go to the health system. They might not be able to afford transport to get to a health centre. They might not have someone else to look after their children so they can actually seek care themselves. And so what we need to make sure in all our policies, regardless of what area of global health this is in, that we are minimizing these structural barriers which prevent women from seeking the care they need. And a lot of this isn't, rapid, sparkling innovation. It's simple things by thinking, well, where are the women? Where are the services? How do we make sure this happens? What are the barriers, which means women won't be seeking them? We also need to think, particularly, I think following on from what Martin has been saying, is that one of the key things we've seen in global health that's been affected by COVID has been the disruption to sexual reproductive health services, but also maternity services and antenatal services. Now, we know that this is both supply issues in that many health services have diverted all their provision or much of their provision to COVID, and therefore these services haven't been running as normal. But we also know there are demand side factors as well. For many women, they don't want to go to a healthcare centre, for they perceive that's a location where you might contract COVID. And so we see this dual tension of why women are not seeking these services. Now, this is having real world effects. Some data that came out of Nepal recently has shown a significant increase in stillbirths, a significant increase in maternal mortality, a significant increase in childhood and early childhood mortality, neonatal mortality. And so this is a real problem. And we also know that these things aren't new. We should have known and we should have done better. We've seen these trends in other epidemics before. We know, for example, that in the Ebola outbreak in West Africa in 2014, that as many women died of not being able to access maternity care during the Ebola epidemic than people died of Ebola in Sierra Leone. This was mirrored in the Ebola outbreak in the Democratic Republic of Congo, where in 2019, we saw women not wanting to go to antenatal services because they feared getting Ebola. And so simple steps were taken by governments. For example, in the DRC government moved maternity services and antenatal services into closed schools because schools weren't perceived to be a place of infection. And that led to increased utilization of the service. And so it's this about thinking beyond the routine provision and thinking of logical steps and asking women, how can we improve our policies, right? What can we do? What can we put into our policies to make it more useful, to make it more possible to access them? And I think this needs to really come across all of the work that you might be doing as parliamentarians across the G20. Simply asking for all your policies, whether this be around access to sexual reproductive health, access to maternal health services, workforce provision, universal health coverage, pandemic preparedness, just thinking about the gendered impacts, thinking about where are the women, how are women going to be able to engage with this, and recognizing that users of global health services aren't just case numbers, they are people. and people interact in societies. And so you need to understand the societies in which these global health interventions are happening to understand how best to implement them. And often that does mean more work because there's not one universal approach, but it can lead to much better outcomes. And so when you're investing the money, and particularly at a time that we know money is tight, and there's been several reasons for why this money is tight, it's about making sure you get the most out of it by understanding how women can use it best. Thank you.
Thank you very much, Dr. Claire Wyndham. Wow, I mean, the part that I really like, where are the women? Where are the services? I mean, that is so true. It's important to support women overcome barriers in accessing health. And, you know, I want to just talk about what has happened in Nairobi. We found that women who were going to actually have children were being rushed because the facilities were not enough. And this is the capital city where we have over 4 million people, and a majority of them are in the informal settlements. Our president, because of his universal healthcare dream, has actually put out 11 centers, hospitals across the county. And in each of those hospitals, we're going to have GBV, we're going to have counseling, we're also going to have reproductive health rights. But of course, the access to family planning, if we don't get the commodities, we never really budget enough for it. We need to make sure that we get the commodities. We also need to arrest trends both on supply and demand side, because that's the biggest problem. We depend so much on donors when it comes to certain interventions. So you might have these fantastic facilities, but if you don't have women being encouraged to family plan because of the religious barriers as well, it's going to be a problem. Access to maternity care is improving. Reproductive health supplies, we have challenges, but we did notice that we needed that intervention in Kenya. We absolutely needed more facilities. Now, it took the pandemic to make us realize that women were being rushed through deliveries. Women were being rushed through, you've had your baby today, we need that bed, you need to get out. You know, we didn't have cesarean sections in all the various hospitals. So I believe that the pandemic woke us up, but as you're saying, we should have actually seen this during Ebola and been able to actually make the right decisions going forward. And as we're seeing the various variants, if we don't learn from what we've already seen in 2020, right, then going forward, we will not be able to make gains. So the fact that we're linking healthcare to gender and women and girls, I believe is amazing. It's the right thing to do. And it will actually be able to make sure that women are not, they access the facilities, and they also have the knowledge about these facilities. I mean, it was very sad in Kenya to see a woman say, I have 11 children. If I knew that there was family planning, I wouldn't have had 11 children. None of my children have gone to school. None of my children have got jobs. You know, I would have been able to have 2 or 3 out of educated them. So that knowledge is coming across in terms of people when you reach them. Community health volunteers, you know, we talked about the people that go out and work and give these services. In Kenya, we have a sector called community health volunteers, and majority of them are women, and they don't get paid. So now we're coming up with a bill to ensure that community health volunteers get money, and we as government are giving them grants so that they can also feel that we're not going to only be used when there's a pandemic. We can also be able to be empowered so that we can also continue looking after our families. Unemployment has been a big issue, and what causes unemployment? Lack of family planning, and then you have a population that you cannot control and you cannot sustain. So wow, that was I mean, I think you covered almost everything that we need to think about as parliamentarians as we advise our governments on projects and programs that they should implement. I would like now to open the floor to any member of parliament out there who would like to make a contribution onto what has been said up to now, you know, from the presentation that was made by Senator Valenti and also Martin Smith, and the presentation by Dr. Claire, so that we can have a discussion that is going to guide us all in the right direction. Oh, okay. So I've just noticed that Honorable Alice Mary Higgins and Honorable Berlin Fernandez have raised their hands.
Yo he levantado la mano, no sé si tengo la palabra o la tiene la otra compañera. En cualquier caso, buenas tardes. Quiero felicitar a Italia por la presidencia en primer lugar y agradecer poder participar en este foro como parlamentaria española para poder compartir reflexiones en cómo, ¿no?, podemos contribuir desde cada uno de nuestros parlamentos para que la salud global como bien común integre los derechos sexuales y reproductivos. Miren, yo soy diputada del Congreso de los Diputados español y desde mi grupo parlamentario entendemos que tenemos un deber con esto porque lo contrario sería un ataque a los derechos fundamentales y un menoscabo para el desarrollo económico y social. Por otro lado, dentro del Congreso de los Diputados, yo formo parte de un intergrupo parlamentario sobre población, desarrollo y salud reproductiva y sexual que quiero destacar, que fue impulsado por la Federación Estatal de Planificación Familiar, y es un espacio de trabajo muy interesante porque allí podemos participar de diversas actividades de interlocución y de intercambio de conocimiento entre los distintos grupos políticos y resto de actores sociales. De este modo, estamos promoviendo diferentes iniciativas parlamentarias que sirven para mejorar la acción del Gobierno. En este caso, por supuesto, me refiero a la salud global como bien común y al acceso universal a la salud sexual y reproductiva. Y quiero destacar dos hitos recientes de nuestro trabajo parlamentario que creo que nos están llevando a alcanzar, avanzar en esta dirección, en la dirección correcta, ¿no? Recientemente, nosotros en la Comisión de Cooperación Internacional para el Desarrollo aprobamos por una amplia mayoría una iniciativa impulsada por mi grupo parlamentario, por el Grupo Socialista, con la que reforzábamos el apoyo ya manifestado por el Gobierno de España para que la vacunación llegue a todos los lugares del planeta por igual, acabando con las desigualdades que se están generando y que estamos viendo en los países más vulnerables. Entendemos que es fundamental reforzar el mecanismo COVAX, aumentar la producción y el acceso a las vacunas, por supuesto, y para ello es importante compartir el conocimiento y evitar que la propiedad intelectual sea un obstáculo en esto. Si algo tenemos claro ya todos y todas a estas alturas es que ningún país puede salir solo de la crisis y por tanto estamos hablando de una cuestión de responsabilidad y de ética. Y por otro lado, y con una prospección más amplia, estamos impulsando un proceso de reforma profunda del sistema de la cooperación española. Hemos iniciado este proceso con la tramitación de una nueva ley en la que hemos abierto un foro de participación amplio para todos los actores de la sociedad civil y en este proyecto y en este proceso de trabajo conjunto, algo que ha sido muy consensuado y además con un apoyo muy amplio, es que la nueva ley de cooperación española debe integrar la promoción a la salud global desde la visión que incorpore el aporte de España en la liberación de las patentes para agilizar el acceso universal y equitativo a la vacunación, a sus tratamientos en casos, claro, de pandemia o de desafíos de salud pública. También destacamos la importancia de la atención primaria en este proceso y fortalecer los sistemas de salud para una cobertura sanitaria universal. Todo ello marcando como prioridad que los derechos sexuales y reproductivos sean una medida de primer nivel que contribuye, por un lado, a mejorar la salud y, por otro, a avanzar, ¿no?, en el derecho a la autonomía corporal. Miren, vivimos, como reflexión, ¿no?, vivimos en tiempos en los que la aparición de los populismos de extrema derecha o las consecuencias derivadas de la pandemia están haciendo que tengamos un retroceso en aquellos derechos de las mujeres que tanto costaron conseguir a nuestras predecesoras. Nosotros creemos que eso nos interpela a centrarnos en la reducción de esta brecha de desigualdad de género y de los prejuicios causados sobre la salud de los más vulnerables. No quiero terminar sin celebrar la resolución aprobada ayer en el Parlamento Europeo para el acceso universal a los servicios de salud y derechos sexuales y reproductivos por parte de todos los Estados miembros y desde luego ponernos a disposición para todo aquello en lo que podamos aportar.
Thank you so much. Thank you so much, Berlin. Thank you so much. Thank you. You raised very important points. I would like to now hand over the panel to Honourable Alice Mary, a Senator in the Republic of Ireland, and who's also a board member of EPF. The floor is yours.
Thank you very much, and I'm aware that I'm going to have an opportunity to chair one of the later sessions, so I won't talk for very long now. But I was really interested in the presentations, and I just wanted to ask if perhaps Clara Martin wanted to speak to two issues. One is that issue of frontline health workers and the vulnerabilities and the protection of frontline health worker, both formal and informal. And I think that's something that you spoke to yourself, Honourable Placeres, in terms of in Kenya, that the formal and informal health workers, and in terms of the impact the crisis has had on them, who are very much predominantly women, but also there has been I think in the positives, as well as the logistical challenges which we have faced, and the inequality challenge, which I think is very clear in the TRIPS waiver. We should have a TRIPS waiver, and it's disgraceful we don't, I believe. But anyway, but aside that, there is also a political shift that has happened. So there has been some opportunistic use of the crisis to limit rights and access to reproductive care. But also on the other side, though, there has also been positive steps forward that I think it's important we keep. And Mr. Martin Smith mentioned specifically telemedicine. And I wonder if you could just comment on telemedicine. And it goes to that idea of bringing healthcare to where women are. And the importance of maintaining that maybe in terms of strengthening reproductive access after the crisis. So just on frontline health workers. And then similarly, at the same time, we also know another online negative is that we've had a lot of misinformation about reproductive health that has been circulated during the crisis. So just if either of you had comments on those points. Thank you.
Thank you, Senator. I would like now to invite, before I make a comment on that, I'd like to invite Honorable Enrique Sanchez Caballo to please make his comments.
Muchas gracias, muy buenas tardes, un saludo a todos y todas desde Costa Rica. Primero que todo, me parece que como hombre en política debo iniciar esta reflexión preguntándome cuál es el rol de los hombres en la política en relación con la agenda de género y la agenda de las mujeres. Me parece que parte del reconocimiento, en primer lugar, de una situación de privilegio de los hombres, tanto en la participación política como los derechos económicos, derechos sexuales, derechos políticos. Es decir, como diría la autora colombiana Catalina Ruiz, antes de considerarse un aliado en la agenda de género, hay que querer ser un traidor del patriarcado y desde ahí plantear las posiciones que vamos a tener en relación con la agenda de las mujeres. Como se ha dicho en este espacio, ha sido evidente los efectos diferenciados de la pandemia en las mujeres, que han profundizado aún más brechas estructurales que ya conocíamos relacionados con derechos sexuales y reproductivos, relacionados con el acceso al mercado de trabajo, relacionado con derechos económicos y sociales y con una carga adicional en las labores de cuidado, por ejemplo, o labores de atención a personas enfermas por la pandemia, a personas que en el espacio de confinamiento, por ejemplo, los estudiantes, las personas adultas mayores, las personas con algún tipo de padecimiento que las convertían en personas con mayor riesgo, pues esa carga de cuidados, esa carga de trabajo se recargó también principalmente en las mujeres. También mucho, como también se ha mencionado, es una realidad también acá la suspensión de algunos servicios de salud sexual y reproductiva como consecuencia de la emergencia sanitaria, donde los recursos escasos se dirigen a la atención de la emergencia, dejando de lado, sacrificando el acceso a los derechos de salud sexual y reproductiva de las mujeres y por supuesto una situación adicional y es algunos tipos de violencia como la violencia física, pues se ha visto profundizada en los espacios de confinamiento o ante la imposibilidad de muchas mujeres de poder salir de sus hogares o buscar otros espacios y o redes de apoyo más seguras. Yo quisiera plantear dos espacios de atención particular, sin pretender que sean los únicos, por supuesto, pero que me parecen centrales en esta dimensión, y uno de los programas de atención emocional y salud mental para las mujeres. Es decir, todas estas cargas adicionales que la pandemia ha generado sobre las mujeres en labores de cuidado, en labores domésticas, la angustia que genera el desempleo o la informalidad, o la pérdida de empleo producto de la crisis económica que generó la pandemia, tiene que tener un enfoque de atención desde la salud mental, desde el apoyo emocional. Y en segundo lugar, plantear la condición particular o de mayor vulnerabilidad para las mujeres en condición de refugio, refugiadas o en condición irregular como migrantes, ya que han enfrentado también entonces retos adicionales en el contexto de la pandemia. Retos, por ejemplo, por no poder acceder a atención médica o temor de acceder a la atención médica debido a su condición irregular, mucho menos a otros tipos de atención sexual, reproductiva, métodos anticonceptivos, mamografías, exámenes particulares para la salud de las mujeres y sin la posibilidad también de poder recurrir a servicios de atención social o de política social o de apoyo social para las personas que perdieron su trabajo o sus fuentes de ingreso durante la pandemia, también por temor a su condición irregular migratoria. Entonces creo que estos dos ejes, salud mental y regularización migratoria, son dos que tienen que estar necesariamente en este planteamiento de una agenda de recuperación post-pandemia con enfoque de género. Muy buenas tardes y muchas gracias.
Thank you so much, Honorable Cavallo. I mean, you raised a very important issue in terms of migrants and refugees. I mean, we should leave no one behind. I wonder if, Martin Smith, do you have any reactions to Alice Mary Higgins' question? We could give you a few minutes to react to her comments.
Thank you so much, Honourable Pasaris. And yes, I do, Senator Higgins. Thanks so much for those excellent points. So, on your point about frontline health workers, you know, have long been the mainstay of delivering sexual and reproductive health services. One of the central high impact practices, a proven high impact practices, to have a cadre of well-trained, highly motivated community health workers. And those individuals have really been the heroines and heroes, quite frankly, of the last 15 months in terms of keeping access to services, particularly often the short-term methods of contraceptives that can be delivered to the doorsteps of clients in this pandemic period. But those have also been the most vulnerable within our healthcare system in many ways. And so the work that countries have needed to do to ensure that PPE, that other protective measures are in place, that those individuals don't leave the health system and leave it further at risk following the pandemic is of critical importance. I think there's been some acceleration in the thinking around task sharing and task shifting, and quite how much in terms of sexual and reproductive health can be shifted to frontline health workers, and a lot of great communities of practice around the world that show that that's possible. So I think there are some green shoots of real possibility there. And the same goes for your second point around the shift to some information services being delivered online, high quality counseling via telehealth has accelerated many years in the space of just a few months in several key places that have family planning challenges. The importance of self-care methods, the DMPASC, as we call it, the self-injectable contraceptive, again, some leaps and bounds within the space of several months that may have taken several years in normal times. And I think a desire to really work in terms of R&D on further self-care, self-administered methods that are really going to meet the needs of women and girls where they are post-pandemic, but also in essentially a changed health delivery architecture. So two very good points and two areas that we're focusing very clearly on in family planning in the post-pandemic period. So back to you, Honourable Pasaris.
Thank you very much, Martin Smith. You raise a good point, definitely. I mean, even in Kenya, we've seen telemedicine started as well, but not, it hasn't reached the grassroots. The majority of people, it will need government's interventions in the areas of telemedicine and the education of the people that they have access to this. But one of the things that we saw during this pandemic, when the government sank over 100 boreholes in our capital city, we saw a reduction in waterborne diseases. So that also meant less people going into hospitals. So these interventions that the pandemic has also seen us do as government has also helped ease the burden in the hospitals. But of course, when it comes to mental health, gender-based violence, unwanted children, we've seen a big problem that we obviously as parliamentarians need to guide our governments into doing the right thing. I would like to thank all of you for your contribution and to ask Honourable Alice Mary Higgins to please moderate the next session on development. Thank you very much, all of you, for your contributions.
Thank you very much, and thank you to Honourable Pasaris. It was a really interesting session, and I think it flows into the next discussion. So what I've been asked to do is to moderate a discussion that looks at the Sustainable Development Goals and applying those same lenses. We know that in terms of gender, it's not simply about the goals under the Sustainable Development Goal 5 on gender, but it's also right across the full picture of the Sustainable Development Goals, including really important goals in the area of health. In terms of the very first goal within target is on maternal mortality. We've heard how that's impacted in the Sustainable Development Goals. It's one of the first targets within health, and that is one that has been impacted, as we've heard, the sexual health and reproductive rights, which is 3.7 under health. And I think something that was touched on, which is target 3B under the Sustainable Development Goal on health, which is around trips and the idea that there should be flexibility in relation to trips in order to support public health. And I think that's, I think it's very interesting, the reason to mention maybe some of those specifics, because I think the Sustainable Development Goals as a joined up vision anticipated, in fact, many of the areas where better and more sustainable and more joined up thinking was needed. So I believe, for example, if we had the Sustainable Development Goals targets achieved, the impact of something like COVID on the world would have been less devastating. So we are looking at a very different, it's a very strong picture. And I think in this last period, we know, in a way we have seen more vividly than ever the importance of multilateralism. We've seen how interconnected we are and how interdependent we are. But we have also seen in very stark relief in recent years, over the last year, the inequalities exposed and the failures of solidarity on things like vaccine access, for example. So we've both seen the gaps in full, true delivery of multilateral cooperation, and we've seen the need for it. And I think something that is really important in terms of the Sustainable Development Goals is too often they were treated before the pandemic as, you know, something on the side that you might add on to business as usual. Whereas now I think we need to be really clear. We've heard also a lot of rhetoric that the idea that we're going to be set backwards in the Sustainable Development Goals because of the pandemic. But in fact, I believe the pandemic makes the case for the need to implement the SDGs. It needs to move them more to the center stage. And so, for example, at a time when a lot of business as usual practices have been shown to fail us when we need them, it's very important that something like the SDGs with that doesn't get set to the side, and that we don't wait for all of the same business as usual practices to re-emerge before we start again on the SDGs, but instead we take those strands which were around gender equality, which are strands around thinking about workers, public services, resilient public services, which are about thinking about environmental interconnectivity and health. All those ideas that are there in the SDGs need to be center stage as we move forward. But however, I would note that while the need for the SDGs, I think, is stronger than ever, the financing and the economic pressures around it are very stark for many parts of the world who have been hugely impacted. And that is where I think we need to almost reaffirm our commitment to the SDGs, but we also need to be very, very strong in front-loading global public funding and investment to ensure that they are able to be achieved in each place in this world, on this shared planet that we have. So those are a few thoughts to begin, but I am mostly very delighted to be introducing our next speaker, who's going to talk in more detail on this area. Mr. Marco Perducia is the coordinator of Science for Democracy. He's Sherpa for 2021 for the Values 20 group, and a former senator of the Italian Parliament, where he focused in particular on the Foreign Affairs, Justice and Human Rights Committee on issues of human rights. And he has also shown and worked on UN mechanisms around human rights, including drug policy reform. And as I say, is a coordinator of the Science for Democracy project, so which I think we can see the link to in the background. So Mr. Perducia, I'm delighted to introduce you, and I really look forward to your thoughts.
Well, thank you very much. Thank you for the invitation and the opportunity to
and
share.
I think the audio.
Can you hear me now? Hello?
Yes.
Okay, sorry. Thank you for the opportunity to share some ideas and also latest developments happening within the United Nations framework. I think from what we've heard so far, the next 10 years could actually lead us to complement the SDGs. There are a few elements that still are not mentioned clearly. And the most important one, and we have learned that over the last 12 months, is science. Science is rarely included. We are taking science for granted. We have taken science for granted, and when we take things for granted, we tend to forget them and forget the importance, and certainly forget the opportunity to interest decision makers to try and address all the possibilities, opportunities, repercussions, and elements of science. Science is mentioned in the Universal Declaration of Human Rights, but most of all, is outlined in Article 15 of the International Covenant on Economic, Social, and Cultural Rights. Science has a very long description adopted by UNESCO a few years ago, and I won't go into that, but is mainly composed of three issues that are key to what we're discussing today. One is freedom of research, regardless of the topic researched. Second is sharing of knowledge. Again, without barriers, economic or technological, without, again, any prejudice that may be imposed by moral or ethical or religious thinking. And the last element, which is certainly the most important and the most crucial for development, is the enjoyment of scientific progress and its applications. Now, if we look at the 17 SDGs and we start from the bottom, the objective 17 talks about what needs to be done to forge partnerships for the achievement of the goals. Actually, not many have mentioned the need to include scientists, researchers, science advocates, science journalists or communicators in this exercise. And we are again missing an opportunity. And on top of all these cultural / political issues, the fact that science is recognized as a human right also brings together the international obligations that countries have vis-a-vis science. The most ratified international document is the Economic and Social Cultural Rights Covenant. It has been ratified by 170 member states. More than 25 have also ratified the optional protocol that creates a quasi-jurisdiction before which individual cases can be brought. In cases in which the articles contained in the covenant are violated, and in particular, we have been working on the right to science to try and highlight how important it is and what are its implications, certainly, and most importantly, with the right to health. And so countries that have ratified this document cannot say no to a suggestion or a criticism, because it's their constitutional obligation to fulfill what they have included in their national system when they ratify the document. And a lot of European countries also represented today, and certainly Italy was one among the first, have also ratified this optional protocol. So they have additional obligations, but they also should provide additional avenues to discuss about these things. So our suggestion for this discussion on development would be to try and find ways, not to reopen the debate about how many or what kind of development goals should be strengthened or restructured for the next 10 years, but do all the best or our utmost to include science. So we have developed a draft parliamentary resolution that talks about that, and I'll be happy to share it with you through the Secretariat whenever necessary or possible or deemed opportune, because we believe that if we mandate member governments to fulfill their obligation, once again highlighting all the elements that the right to science has, and there's a general comment adopted by the UN in April 2020 that helps us in this way, and it talks a lot about inclusion. I wanted to mention only one thing about gender inclusion in science. Not only 30% of researchers are women, but only 10% of women are at the center of clinical trials. We are developing medicines and treatments for women, testing them on men. And the final result is something that doesn't work. So this is incredible. And we have to open debates about this as much as possible, involving the scientists and people that may benefit from that kind of research. And the COVID example is clear. We are seeing a vaccine that apparently is weaker on women than on men. These are the latest statistics. But if you, the vaccines, unfortunately, create more problems on women than men. And that may also be the result of the fact that it has been tested mainly on men. So I think we should go towards a coordinated cooperation of scientific progress, but at the same time, a more coordinated and funded cooperation when it comes to the outcomes. As far as the G20 is concerned, and I will close with this, I posted the website in the chat. We have been working on the three priorities identified by the Italian presidency, people, planet, and prosperity, on three main values that have a lot to do with what you've said today: integrity, solidarity, and sharing. Our value package should be finalized by the end of July, and we will have our summit in mid-October. And at the website, you can find updates, and we'll be happy to have also some of you not only attending, but also possibly as speakers. Thank you very much.
Thank you very much. And while people are gathering their questions and putting their hands, I just to comment, one thing that it strikes me in relation to the role of science is, and in the partnerships, is public-public partnerships. Because this is a debate that myself and others have had in Ireland. Again, is there is a long, I think, a mindset for many times that it is only public-private partnerships that we must look to in terms of science. And so you have international, for example, maybe corporations who different countries are partnering with, but the idea of countries partnering with each other, for example, to build on each other's frontline or basic research, it strikes me that that idea of public research is more important than ever, and particularly so that we don't encounter, as we've heard in the former discussion, the kinds of obstacles of in relation to intellectual property or profit maximization, that we are able to scale up response. Because it seems to me COVID was one test of this, but certainly climate, for example, and responding to climate change will be another situation in which we will need to share solutions and ideas and innovations to scale and in multiple places. And I'd be interested in your thoughts on that, but I just want to check first if there's any questions yet, and I would encourage people to put their questions. But if you had any thoughts on that public-public partnership, just to begin.
Well, this is what we mean with coordinated cooperation. So because the main actor now also during the pandemic and in trying to fund research for the developing vaccines have been governments. So, I mean, one could have different visions on how to organize global trade or production, sustainable production, but certainly I agree with you, especially something that is not happening within the European Union, where you have a political union that does not collaborate on some key issues. There's plenty of grants, there's plenty of special projects and framework program, but there's no such thing as a public-to-public kind of cooperation, or at least there is, but it's not considered to be a top priority. Also to go in the direction for which the United Nations were founded many years ago, that is international peace and security. The International Day of Science also talks about peace and development. And we're forgetting about the potentials of science when it comes to also foster these other kinds of activity. Of course, it would be crucial, at least this is what we're trying to suggest, that one of the pillars of international cooperation should also become investing in science in least and developed and developing countries. We only have sequenced 3% of African DNA. Africa is the biggest example of biodiversity in the world, and we only know 3% of it. Of course, we have to take care all the necessary cautions, that knowledge not to be exploited against the people on which we are carrying out the studies, but at the same time, we're lacking 97% of the makeup of humanity, and that's incredible. And it certainly is blocking science, and it's blocking the finding of therapies, treatments, and best welfare and well-being conditions for the world.
Thank you very much. Now I'm going to just quickly go to our list of participants.
There's actually a question.
Perfect. What is the level of global commitments to ensuring availability of the vaccines to poorer women is one of the questions that we have. And yeah, I think that's, well, I'll go straight to you on that, and then I have another thought to follow.
Well, I don't think there's actually a special category for poor women, but one of the commitments that came out of the Global Summit on Health that was held in Rome on the 21st of May, hosted by the Italian presidency, was to arrive at 1 billion doses for non-rich countries, let me call them that way, so low and income countries. 1 billion is certainly a lot, but it's not enough. We have to make 10 times that sum available in the next 6 months if we want the vaccine to have an impact. So that is the commitment as of today, and it goes through another exercise launched at the beginning of the year by the European Commission and WHO that's called COVAX. And we hope that in this case, it would be good to have also a lot of private money being chipped in, but because we have to enlarge that availability as much as possible.
Yeah. Well, thank you. And I've just want two things to announce. One is I've just mentioned, because of the Sustainable Development Goals being the theme of this session, I just want to draw attention to the Parliamentarians for the Global Goals, which is a network of global parliamentarians working on the SDGs that I am one of. And the link has been put in the chat alongside the link provided by Mr. Perduce in terms of Science for Democracy. I think it's really interesting, as you say, 1 billion is not enough. And it points, I think, to that idea of innovation. And to my mind, one thing I think is when we think of science, maybe just, and I know we're going to pass to the next panel shortly, but you mentioned empowerment, I think in terms of when we talk of things like DNA or data, I think the empowerment of individuals is important because it gives them that engagement with science. And it strikes me as well that we have thought of innovation as something that belongs to risk takers rather than caregivers. And I think the idea, if one thing we've seen from COVID is that caregivers, the necessity of those who serve the public good and that imperative is as strong an imperative for innovation and much better in some senses than solely the seeking of risk or the seeking of economic opportunity. Just if you had a last thought on that, and I don't have other questions, but I've put the links and I'm sure that you will hear contact from different attendees.
I totally agree with you. So the key word there is participation. We have learned that everybody can make a difference. So the mere
Excellent.
fact that people have worn their mask or kept their distances without necessarily the use of the army for us to do that, it's a part of what we identify as an integrity component of a community. And so I think
Excellent. I've actually seen, apologies, I realize because we're just running out of time, but I noticed one hand that I hadn't seen from Angambwikwe Ngwavi. If I might ask you just to ask your question. Apologies to come across you, Mr. Producer, but I wanted to make sure our question got asked. If you wish to ask the question. Angambwikwe Ngwavi. Okay, I'm not seeing them indicate further. If you are there, if you want to turn on your speaker. Okay, well, perhaps it will emerge again in the chat. So again, thank you so much, Mr. Perduce. And I now have the honor to pass to the next panel, Stefania Burba, who is chair of Civil 20, who is going to take the floor and introduce the next panel. Thank you very much.
Hi, can you hear me?
Yes.
Yes. Okay. Dear honorable members of Parliament and all participants, sorry, okay. I have the honor to speak on behalf of the Civil 20, the G20 engagement group gathering more than 560 civil society organizations. I wish to thank the Italian All-Party Parliamentary Group, APS, and IDOS for organizing this high-level parliamentary consultation and for inviting me. I'm pleased to share with you some of the recommendations that the G20 submitted to the G20 Presidency regarding the consultation topics. Sorry, I can hear the translation, and so I don't know if I have to do maybe.
If you go to mute original audio, maybe, or.
I did. Now? Okay. Now you can hear me? Okay, sorry for this problem. So I was saying that I'm pleased to share with you some of the recommendations that the Civil 20 submitted to the G20 Presidency regarding the consultation topics, and I hope you will take them into consideration when formulating health and sustainable development policies and when monitoring that the commitments made at national level from your governments are fulfilled. So with regard to global health, to achieve universal health coverage, policies on pandemic preparedness and response must be human rights based and gender transformative. This is urgently needed to overcome the limitations of the current responses to health interventions and to address future pandemics. COVID has exposed the lack of preparedness and the impact of decades of either undermining or insufficient development of public health systems, including community health systems. It has also made obvious the need to invest in human resources for health. Women are disproportionately affected by the inadequacies of healthcare systems as they are burdened, as other speakers have already said, with excessive and unrecognized caregiving workload. So our recommendations to MPs is to consider public financing at the core of public health services and to focus on preparedness, strengthening public health systems, including community systems. Then, inadequate responses by governments to COVID resulted in the reduction and or interruption of health. Again, other speakers have already highlighted that interruption of health, nutrition, and social services, not just health. And in addition, unequal and punitive measures resulted in human rights disproportionately affecting women and girls, exacerbating gender-based violence and further reducing access to sexual, reproductive health services and rights services, including access to HPV vaccination, essential maternal and child health care, and safe abortion. So policies to tackle future pandemics should include strategies to keep active and accessible all essential health services everywhere, and including for refugee, migrant, and displaced populations. In addition, the elimination of legal, financial, and gender-related barriers that impede access to healthcare is essential for any successful health response to ensure equitable access for all. And gender medicine, it should be enhanced and promoted in order to make the right to health more inclusive and responsive to the impact of gender and sex on health and diseases. Now, we hear a lot about global health security, but we prefer to speak of global health solidarity that must be the driving force towards achieving the 2030 agenda within the multilateral framework to ensure that health policies do not further exacerbate inequalities, especially impacting women and girls in all their diversity, vulnerable groups, marginalized communities, and key populations. One more recommendation is to develop global health policies that do not just address the emergency, that of course is important, but have also a long-term perspective for strengthened health systems. We need, therefore, structural reforms of global health systems. And to this end, the One Health approach that recognizes the strong correlation between human, animal, and environmental health should be adopted as the best approach to prevention, early detection, and surveillance of future pandemics, while also addressing current chronic epidemics. We can't forget HIV, TB, and malaria, for example. So a gender-inclusive One Health approach should be absolutely adopted at regional, national, and global level when speaking about policies. And the last two things, moving on to policy processes, transparent, accountable, and inclusive processes must be institutionalized for the participation of women and girls, communities, and civil society in all levels of decision-making to ensure that policies needed to strengthen health and social systems are collectively owned and monitored both by governments and citizens. So ensuring and empowering the leadership and contributions of women is absolutely central to recovery and will contribute towards achieving gender equality. Finally, I would like to share with you some considerations on access to COVID tools. We, as a Civil 20, call on the members of parliaments to fully support the ACT Accelerator and the CTAP to share the knowledge of intellectual property and data, as well as the TRIPS waiver for COVID tools to maximize their global production capacity. And this includes to invest in thermostable control tools to make the rollout of COVID tools accessible to low and middle income countries where the cold chain cannot be maintained, and therefore resulting in reduced gaps in the access of these tools for women and girls and vulnerable groups. Thank you very much again for this invitation and for this consultation. Thank you very much.
Thank you very much. And I think that was an exceptional piece of drawing together. And I should, of course, have added your role when I introduced you as co-spokesperson for the Global Call for Action Against Poverty in Italy and as advocacy officer with the Global Health Italian network. And I think what you've done is you've pointed to the full breadth of the different issues, be it from HPV right through to all the other aspects of health care, and also the interconnection that we need in our approach to this. And I think crucially, you have both reminded us and illustrated the importance of civil society perspectives in joining the dots, in the same way that when we talk about the SDGs, we want to make the connections on how we can work more effectively in solidarity together. So thank you very much. And I do have just a question that came in late, but I think was very important. It actually answers to, it was a direct question in respect of the feedback impact of European and US research about sexual reproductive health and rights in Africa to African countries. And I think it was very timely in a way when we talk about that question of ensuring that people are empowered and supported, and not simply the subject matters, but the agents in terms of health. So I'm going to, if it's okay with, I'm going to just briefly go back to Mr. Perduccia to answer on that. And I know what you said as well, Ms. Burbo, on the ACT accelerator, the TRIPS waiver, COVAX, of course, but also CTAP. And I know we have Costa Rican members who are here in the group as well, in terms of that COVID technology access pool. But if you wanted to comment, Mr. Perduccia, on the feedback impact of sexual health and reproductive rights research by US and European countries in respect of African countries.
I think to the best of my knowledge, can you hear me?
Yes.
Because I always get a strange message on the microphone. To the best of my knowledge, those studies have actually tried to demedicalize as much as possible the provision of services, counting on women to be the multipliers of the provision of services. So we have moved from a more theoretical / scientific approach to a more pragmatic approach. And I'm aware of studies and examples like in Ethiopia, where we organized a congress last year, a couple of weeks before the arrival of the virus, where in 3 years, the number of women involved in providing services, sexual and reproductive services, in a country that is huge and have also over 100 million people, have grown simply because deciding to not use only doctors and nurses to do that, but to empower people in villages further into the bushes to do just that. So we have all the theories we need. We only should find the best way to apply those theories in specific context. I don't know if this is the answer that was needed by this kind of questions, but I think this at least is what our work has come across, this kind of studies.
Okay, and I'm going to, I think, and there was, unless we had that other person who had indicated, and we just have 3 minutes left. I don't know if they want to come back in, Mr. or Mrs. Angambuike. If not, yes, then I will go to our conclusions. I think it is interesting in this. I think there is the health communication piece, which is one piece in this respect, but then there is also that importance of ownership and of autonomy. And I think that's, for example, even in areas such as data and DNA, all of that links to the point of, I think, of global agency and a rights-based approach to health. I think it empowers research and it encourages take-up also. But I'm going to now conclude. We're coming to our last 2 minutes. So unless there's an urgent or pressing question, I'm going to go, oh yeah, yes, we have it there. I'm going to go to Senator Valeria Fedeli. So Senator Valeria Fedeli, and I want to just as well, again, really thank the Italian group for giving us the opportunity to speak together today and to bring together, I think, some really interesting inputs and certainly some connections I will look to follow up. And I hope that many of you attending will also look to follow up some of the parliamentary links and the research links that we have seen highlighted today. And with that, we get to have a beautiful view of the Senate behind Ms. Fedeli. So I would like to pass to you to conclude. Thank you very much.
Tanto grazie, veramente grazie Alice. Noi siamo davvero arrivati a queste 2 giornate, anzi alla conclusione della seconda parte della consultazione dei parlamentari di alto livello e del gruppo che il gruppo italiano informale del Parlamento ha organizzato con AIDOS, che voglio ringraziare, così come voglio ringraziare IPF per il contributo che è stato dato al lavoro di questi giorni e soprattutto alla interessante, importante, secondo me, comunicazioni, riflessioni, informazioni, opinioni e anche proposte che sono uscite in queste 2 giornate. Quindi voglio ringraziare tutti i relatori e le relatrici per davvero il qualificato contributo. Credo davvero che aver ascoltato in queste 2 giornate contributi di diversi paesi europei, dei paesi africani, ci metta davvero nella condizione per poter fornire al G20, a presidenza italiana, diciamo, tantissimi elementi perché il G20 abbia al suo centro, nella parte di iniziative e di decisioni, il cuore della nostra discussione, e cioè abbiamo poi tutti convenuto, sia guardando e sapendo leggere che cosa è successo alle donne durante la fase pandemica, ma soprattutto che per uscire effettivamente dai problemi che la fase pandemica ha determinato e per puntare sullo sviluppo sostenibile, paritario, equo, civile, bisogna mettere al centro il rispetto dei diritti delle donne. Quindi io credo che tutte noi, convenendo sulla necessità di tenere davvero alta e centrale l'attenzione dei governi del G20 sulla parità di genere, proprio dando, come abbiamo fatto in queste 2 giornate, il senso fondamentale che per avviare e superare tutti i gap e le storture che abbiamo verificato bisogna assolutamente avere e avviare piani, strategie e politiche concrete che devono assolutamente rendere anche le parole che vengono utilizzate sulla parità di genere, bisogna che corrispondano adesso azioni politiche concrete, investimenti, capaci esattamente di dire che ciò che si promuove per superare tutte le diseguaglianze e le difficoltà e gli ostacoli che si frappongono alla piena e autonoma sviluppo delle donne, della loro autonomia in campo di salute, in campo di sicurezza, in campo anche lavorativo, dell'istruzione, serve certo alle donne, alle ragazze, alle bambine, ma serve all'intera società, serve a tutto il mondo. Ecco, a me pare questo un concetto importante che possiamo consegnare, perché abbiamo tutte misurato che con la pandemia è aumentata la diseguaglianza, sono peggiorate le condizioni di vita delle nostre donne, delle ragazze, ed è aumentata, veniva detto, la violenza degli uomini sulle donne, una violenza che ha anche fatto vedere, come è stato detto in alcune importanti comunicazioni, anche la violenza attraverso anche i nuovi strumenti di relazione, cioè la digitalizzazione. C'è stata un'interruzione dei servizi, c'è stato un blocco della pianificazione familiare, lo diceva bene all'inizio, è stato anche ripreso da altri interventi, e questo è un danno enorme. Ovviamente noi dobbiamo invece mettere al centro il fatto che non solo non devono essere diminuiti gli investimenti pubblici su questi terreni, ma bisogna considerare invece gli investimenti per ripristinare la pianificazione familiare, per contrastare tutte le pratiche dannose verso le donne, invece un elemento non solo di civiltà, non solo di giustizia sociale, ma di necessità per l'insieme della società. Perché, ce lo siamo detti in queste 2 giornate, la parità di genere si ottiene davvero se si avviano i programmi volti a contrastare anche gli stereotipi che caratterizzano le nostre società, se si punta davvero all'investimento sull'educazione delle bambine e delle ragazze dalla scuola primaria fino all'università, e tra l'altro facendo particolare attenzione, io penso in particolare al mio paese, attenzione ai processi di partecipazione delle ragazze alle discipline STEM, che è un altro degli elementi, quindi collego al fatto che è fondamentale anche il diritto alla conoscenza, all'alfabetizzazione della scienza, perché la scienza è un altro dei grandi terreni di sviluppo democratico dell'insieme delle società. E ci dovrà anche essere la volontà, io credo, di riconoscere e valorizzare ovunque i lavori di cura, che vuol dire che devono essere valorizzati, immessi sul mercato con figure professionali qualificate, non lasciate semplicemente alle donne perché donne, perché anche questo è uno degli elementi che nelle nostre società fanno vivere la discriminazione, non consentono una libertà di scelta alle donne di stare nei lavori che professionalmente vorrebbero poter svolgere. Ecco, io penso che ci sia davvero, come ci siamo dette, una sbagliata, discriminante e ingiusta distribuzione del carico di lavoro di cura, e quindi mettendo invece al centro l'empowerment anche economico delle donne e delle ragazze, noi riusciamo davvero ad avere una visione per uscire dalla pandemia, per affrontare le contraddizioni e anche le discriminazioni che abbiamo palesemente visto in questa fase così pesante della pandemia. Insomma, verrebbe da dire, se non fosse anche grave, pensato in questo modo, la pandemia ha fatto scoperchiare in tutto il mondo forti diseguaglianze che noi già conoscevamo, ma non si può pensare che il post-pandemia aggravi quelle diseguaglianze, quelle discriminazioni, e che poi sono violenze verso le donne, come sappiamo tutti, ogni tipo di discriminazione verso le donne è violazione dei diritti umani. Quindi da questo punto di vista non possiamo nemmeno nel linguaggio pensare che il post pandemia significhi ritornare alle condizioni precedenti. No, invece dobbiamo esattamente capovolgere i paradigmi con cui affrontare i problemi che abbiamo vissuto. E in questo ambito il tema della salute deve essere veramente un tema da diritto umano da garantire a tutti. Qui permettetemi di risottolineare un elemento che è entrato nel dibattito oggi pomeriggio, quello del valore della scienza, proprio come valore di accesso democratico, la ricerca come elemento fondamentale per avere cura delle persone, cura dell'ambiente, cura e superamento esattamente anche diciamo di un concetto che andrebbe ripristinato, non dell'egoismo dei ricchi, ma di una capacità di esprimere di nuovo solidarietà, grande cooperazione internazionale. Anch'io le considero parole chiavi fondamentali, perché l'accessibilità, per esempio, ai vaccini in termini globali è un interesse di tutte e di tutti. Penso che anche questo sia un elemento molto importante. Infine, noi dobbiamo promuovere la medicina di genere, perché anche qui mai smarrire. Quando noi diciamo che va messo al centro il cuore, deve porre al centro le politiche della salute di genere nelle politiche globali, significa che noi non dobbiamo mai avere, questo va detto ai paesi del G20, mai avere politiche neutre, perché politiche neutre che non tengono conto della differenza di genere sono politiche che aumentano le discriminazioni verso le donne e non fanno superare ciò che le donne purtroppo subiscono. Quindi anche promuovere la medicina di genere è un elemento molto importante. Significa veramente anche definire sempre di più impegni per contrastare ogni forma di violenza degli uomini verso le donne in ogni contesto, e io dico anche nel contesto migratorio, perché anche questo è un elemento, diciamo, della solidarietà, della visione della cooperazione internazionale necessaria. Significa anche ripensare proprio anche i modelli di convivenza democratica nelle città. Bisogna ripensarli esattamente sapendo che stiamo parlando di una fase nuova anche dell'umanità che deve affrontare nuove sfide. Queste sfide si possono affrontare se si ha questo sguardo e se si mette al centro davvero i diritti delle donne. Mi pare che questo sia poi un elemento importante. Voglio chiudere con due elementi. Il primo elemento è che particolarmente importante, lo riprendo qui in questo saluto conclusivo, quello che il Parlamento europeo 2 giorni fa ha votato a larga maggioranza, non all'unanimità ma a larga maggioranza, che ha votato la risoluzione per garantire l'accesso universale alla salute sessuale e riproduttiva per le donne, con diciamo diversi elementi interni molto importanti, appunto, che anche nel nostro dibattito di questi 2 giorni sono stati ripresi. Quindi c'è anche un passo ulteriore che in sede europea è stato fatto e che adesso va tradotto ovviamente nei singoli paesi, oltre che a livello internazionale mondiale. C'è un ultimo punto che voglio riprendere in questo saluto conclusivo che riguarda la governance dei processi di uscita dalla crisi, quindi dei processi della scienza, nei processi che decidono gli investimenti. Lì ci devono essere le donne. Senza una governance condivisa a ogni livello, e noi come parlamentari su questo dobbiamo sempre batterci, ecco, senza una governance condivisa, paritaria, è difficile che le politiche per uscire dalla crisi pandemica, per riprogettare lo sviluppo sostenibile, equo, paritario, ecco, possa effettivamente essere raggiunto. Per questa ragione credo che il nostro lavoro di questi 2 giorni sia stato molto importante, lo faremo presente ai governi del G20, alla presidenza italiana. Chiudo ringraziando anche tutte le persone che hanno consentito anche il lavoro di interpretariato oltre che di presenza, e ringrazio ancora tutti per la qualità dei contributi che sono stati dati. Grazie e a prestissimo.
Thank you.